Mom Who Knows Nada. My name is Brianna, and this is the Mama Knows Nada podcast. We have a fertility expert today, and I'm super stoked to talk to him. This is Dr. Marc Sklar. He is the fertility expert. He's going to share some incredible insights about how we can take control of our fertility. So, Dr. Marc, thank you so much for being here. I appreciate your time.
Yeah, thanks so much for having me. I think this is going to be a fun conversation.
Oh, yeah. So let's get right into it. What inspired you to focus on fertility issues?
Oh, so that's a fun story. I didn't really I always had a fascination and interest with hormones and women's health, but it wasn't something that I thought I would actually take up as a career. And then when I was in my last year of training and I was seeing patients in the clinic, really, it's not like you're doing marketing or anything like that in the clinic, but inherently what would come through the door and the patient population that would see me was pretty much 90% women's health, fertility, hormones, and all of that. So it kind of pushed me in this direction somewhat naturally. But the real kind of push that flipped the switch for me was the first patient that I ever helped. She had PCOS, and she and within, to keep a relatively longer story short, within about 4.5 months, she was pregnant. But when she came in to tell me she was pregnant, she didn't know she was pregnant. She's like, my cycles are off again, and I don't know why, and I haven't gotten my period again, and I don't know why. And I'm looking at her, and I'm thinking about things and where she was, and I said, how about you just go to the bathroom and take a pregnancy test? And she came back, and it was positive. And just the surprise and joy on her face to me was amazing. But I always say, for how impactful I was in her life, which I helped her with her next as well. She was far more impactful in my life than I was in hers, in my opinion, because without that actually happening, I don't know what would have happened. I mean, that feeling that I got inside when she was able to get pregnant, and when she sent me, pictures, and I got to meet her, her baby Faith. It was just,
so sweet.
Really life-changing for me. So that's really what pushed me in this direction. Yeah.
I love that. As somebody who was diagnosed with PCOS and then had a kid without any other interventions, I think that story speaks volumes. Well, for me, because I lived it too. and also, and I'll probably comment here and there on some of the things that I did, just by complete and sheer ignorance, and then discovered, oh, I'm pregnant, and I had no idea. So I think that's really just a fascinating launch in for you. So what do we misunderstand about our fertility? What can influence our hormones that we're just not paying attention to?
Well, I think that is a really big answer. In brief, I could say I think everything, and I don't say that to be, funny or rude in any way, but the reality is everything we do impacts our health, period. And so, and in turn, our health is going to impact our hormones is going to impact our health. And so we need to understand that. Now, it doesn't mean that when I say this, it doesn't mean that we all have to be angels and perfect. There's no such thing really, right? But it's really about us taking, I think, a little bit more ownership in our ability to impact our health and our hormones and our fertility, both positively and negatively. Because all too often what I see in this journey is that we either don't take our own personal responsibility for it, or we give up that personal responsibility and work up to somebody else to kind of fix us, right? They're going to give you a pill, they're going to do this, they're going to do that, and that's what's going to fix what I've got going on. And that's not, I'm not a big fan of that piece. I'm not saying that we don't need guidance, but we still have to feel in control. We still have to feel like we can make decisions, and we have the power to make those decisions, and our decisions are going to impact our fertility and our health, in every facet. And I think that's really something that we all need to take home. And I say this I could really say that about any health condition, right? It's not unique to fertility or hormones. But the reality is all of the things we do on a daily basis absolutely impact our hormones and all those choices we make. And so if we can just take a little bit more ownership in that and recognize that, I can change so much, I can influence so much. And I hear that story all the time that, I forgot, or I didn't realize that if I just did these things or that I could make, that much of a difference. I didn't think it was going to be that impactful. And it is. And sometimes it's as easy as like, I just need better quality sleep, or I need to be consistent in my better choices with food, whatever it might be. For all of us, it might be one specific thing. And for some of us, it might be, a combination of things that we need to change, but it's got to start someplace. So, we pick one thing, we make some choices there, and then we kind of grow and evolve and progress from there. But if there's one thing I would encourage everyone to do is to steer away from the things that you do well. So like, if you know that you've got the diet piece dialed in and you cook really well and you got all your own food and you've got your garden or whatever, means to you, then don't, that shouldn't be the brunt of our focus, but that tends to be where we focus because it's easy. We're comfortable with it. It's in our box of comfort, and we've got a routine for it.
Totally.
So I would say, like, look at the areas that need improvement that you're not really spending time on, and that could need a little bit more attention, and kind of focus that energy there.
That is really good insight. And just to kind of piggyback on that for a second, like once I started eating cleaner, like I worked at True Food Kitchen, and I've talked about this a couple times in podcasts. I worked at a place called True Food Kitchen, which is,
I love True Food Kitchen.
It's the best, right?
Ate there last week.
Oh, it's the best. I miss it, actually. I'm always like seeking it out, but it's like 45 minutes from my house now. Anyway, that's a me problem. But the food there is actually very clean, and it's an anti-inflammatory diet that's inspired by Dr. Andrew Weil. And just, it's just better food. So I don't work anymore, but I will always advocate for them. And I was the healthiest I'd ever been in my body. I didn't weigh the least. I wasn't as muscularly toned, but I just felt good in my body. And that's when I got pregnant. I was told I couldn't have kids. I was going to have fertility issues. I would have to have interventions, blah, 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 blah. I started seeing an acupuncturist when I was 26, just to kind of naturally alleviate it. And then lo and behold, 6 years later, I'm knocked out. That's my story. So, and all these things, like this, that, the other thing. And then I just remember looking at my now husband and saying, I either have something is wrong with my brain or I'm pregnant, because my body was just like rejecting alcohol. I had chronic migraines, and I was like, something's wrong with my head, or we're having a kid. And I was shocked when it was having a kid. So there we go, people. There we go. So I'm sure a lot of your clients come to you with issues like PCOS, as you've mentioned. What other issues are linked to infertility or can influence our infertility?
So many. I mean, the big ones that I think most people, I would assume, have heard of. So, PCOS, polycystic ovarian syndrome, endometriosis, fibroids, male factor. So all the sperm related conditions. So low sperm count or concentration, poor motility, poor morphology. Those parameters are big ones that don't get a lot of attention and time. So I like to mention them. I think the biggest thing, and then all sorts of hormone related conditions. Thyroid's a big one. Stress is a big one that I wouldn't classify as a hormone, but it absolutely impacts your hormones. So stress is a big one. But I think one of the bigger things that I see, and maybe it's just with the population that I tend to work with or whatnot, is a lot of this either self-diagnosed or given by their endocrinologist is low ovarian reserve or diminished ovarian reserve or poor egg quality. These diagnoses of basically my ovaries aren't working and you need to do IVF. That's how I term those diagnoses. Those are the diagnoses that say, oh, you've got this, you need to do IVF. But I'm not a huge believer. I should actually put into that also unexplained, because people do kind of latch on to that as a diagnosis, but it's not really a diagnosis because it's unexplained. Right. Those are the big ones. My least favorite ones are the ones that I mentioned at the end. Diminished ovarian reserve, poor egg quality. Yeah. Explained. I'm not a big fan of those because I think, one, it gets us thinking really negatively about ourselves and our abilities. And two, I think they're overused and often misused. So, those are not my favorite for those reasons. Yeah.
I can get behind that too. I had a podcast guest tell me with her doctor said her placenta was getting too old, so she had to be induced. And she was younger and first kid. And then I was like, what does that even mean? Like, your placenta can't get old. Anyway, that's, so you're just like, you hear this stuff as women and you're like, oh, you can't. But it's like, well, maybe I actually could. I also like how you touched in there with like male issues, because sometimes it isn't what's wrong with a woman's body. Like sometimes it is our partner, and that's okay. Like, that, I think we assume so much of that burden in reproduction that we forget that there's two parties involved.
40 to 50% of all fertility issues are male factor. And I'm not saying that there's not sometimes double, an issue on the female side and an issue on the male side, because there absolutely can be. But we forget and ignore, because of that very reason, any treatment tends to be pretty much focused on the female. And for that reason, the male kind of gets pushed to the side in terms of a real issue that needs to be addressed. I have seen that change recently, but we could see a little bit more of it.
Yeah, right. I just like that you covered it. I think it's so important. Now, we are put on birth control as women. Oftentimes in our teens, as soon as we get our period or start menstruating, all that fun stuff. So how does birth control impact our fertility?
Yeah, for me, it's multifaceted. Certainly there's probably a time, I probably feel like it's probably less needed than most, but there's probably a time where someone does really need birth control in certain circumstances. As a bridge, I would say, to get the proper support and care that they need. But it's often used as treatment. And in my mind, it's not treatment. Like, so for a woman who has PCOS, who's not menstruating regularly, or is having any other issues with that, a woman who has a lot of severe menstrual pain, they might put you on the pill as a treatment to address those issues. It's not a treatment. It's a Band-Aid to cover it up until you get to a point in time when you're ready to have children. And then they say, oh, you can come off of it. Well, I mean, how about we address it if we know that there's something that needs to be done? So
imagine that.
Go to your doctor and you say, well, I'm having issues. Oh, you have PCOS or you have endometriosis or whatever it is. And they're like, okay, well, this means that you have inflammation and you have, you're not ovulating properly. And so we've got to regulate your hormones. And how about they focus on actually doing that versus giving birth control? So I think birth control is overused and misused quite a bit in that regard. Because of that, I do find that there's if someone has to go through fertility treatments at a fertility clinic and it is routine and normal to use birth control in those circumstances for various reasons, that they are they're less apt to want to do it, which I understand because they have previous experience with it that wasn't great. But in those circumstances, it's a bit different because those should be really short-term uses, to get you to a point where you're ready to move forward with your IVF cycle or whatever it might be. And what I'm discussing here is different, where they're going to put you on birth control and you're going to be on it for years as a means to, treat or address your hormonal condition. And I'm not a fan of that at all. I think that causes all problems. Now, what I will say is one of the things or one of the benefits I do see, and I've seen that recently for whatever reason it's come up recently. I have I think she's 41 and I just checked her labs and she had stopped. I think she's been off of birth control for now a couple of years, but she was on it for many, many years prior. And she was concerned that was going to negatively impact her fertility. And in her case, what it did was, because she was put on it because she was sexually active, it was different than treating some sort of hormonal condition. And when we tested her hormones looked beautiful, and she had tons of eggs, not just for a 41-year-old, but for a 31-year-old, her numbers looked beautiful. And I do think some aspect of that was because she was on birth control for so long that she was, holding on and preserving some of those eggs that would have otherwise been used repeatedly cycle after cycle. So, I don't want to say that as oh, if I want to preserve my eggs, I'm just going to go on the pill. That doesn't happen. That doesn't happen for everyone. And I still don't think it's a wise choice to use it in that fashion. But in her case, that was like a little benefit. My preference, if there's an issue, is that we address it. Like if you know that there's a concern in whatever condition that is let's get to the bottom of it. Let's address it. Start making the proper lifestyle choices, especially if we're young, we're teenagers, which it's hard to make those changes when we're teenagers. But if you're a teenager and you have so much opportunity at that point in time to make these wonderful changes that could impact your health and your fertility in the future. I'd love to see some more of that happen in real life.
Yeah, just like a little bit more intentional, a little bit more purposeful, a little bit less like, here, go on a pill and fix it. Like I know 2 people who got pregnant on birth control, first of all. I have blood clots from birth control.
There's side effects from birth.
So something that's supposed to protect, it's always that 1% chance, but I do think that getting to the root cause of something, because it's not going to go away. Whatever the issue isn't going to go away by taking a pill. And again, birth control does have its place and time. But I love that you're saying, let's get to the root cause and let's try to figure something out. I think that's so important that, for women and men to understand that there's probably something else going on that we could kind of take care of.
Yeah. And if you have, let's say you need it as a bridge, take it for a short period of time while you find the right person to support you to address the root issues and figure things out. That's a different story because your long-term objective is to come off of it and really address it. But it shouldn't be the main treatment.
So if there was one piece of advice you could give anybody to help them take control of their fertility or their hormones, what would that be?
If I had to pick one thing, I would say get testing done. Get proper testing done. I don't think there's one answer to it because I think with the proper testing, you need the proper guidance.
Right.
So that would come with it, is that you need the right person to be able to interpret those labs or even order the right labs for you to then create the right plan for you to move forward. So, I think it's multiple, but, and I hear all the time, I've had all the testing done. I've had my hormones tested. And I can't stress enough. I repeat this all the time. There is such a small percentage of those of you who are listening who've had all the testing done or the right testing done. It's unbelievable, how true that really is. And for each one of, I think part of that is also that each one of us, the proper testing is going to be a bit different.
Totally. Absolutely.
Yeah. Like it's one thing if someone said I had all the hormone testing done, and even in those cases, I don't find that that's accurate. But that aside, that's one piece, but you might need other testing, maybe because of this and your history, you actually need more stool testing or digestive tests to be assessed to be able to understand how that's impacting your hormones, or maybe there's a different way to interpret or to test your hormones. I do a couple of tests for your hormones as well, like saliva or urine versus just blood. And so it's not, I think if we're looking at it with a limited lens, then we might take that stance that like, no, I've had everything done. But in general, I don't find it's true. And a lot of that doesn't even have to be lab tests. It could be imaging or other investigation to look at the uterus. And I mean, there's so many variables at play that I really don't find that most of us have had the right testing done, which is why I started with that, because I think it's essential for getting real answers for how we need to move forward.
I mean, I think that's a great answer, because if you don't get to the root cause, when we were just talking about, how can you have the right plan in place? And how can you find the right people to support your journey? And how do you know who the right people are if you don't know what the problem is? Exactly. I think that's great. Like, that was not the answer I was expecting. So I'm pleasantly surprised. So when should we actually seek a professional or support, from someone like yourself? Like where's that cusp of when you've done everything, or maybe you haven't done enough, maybe you think you've done everything, like you just said, but you need that guidance? What is that? What do you recommend for someone to seek out professional counsel?
Yeah, I think I love, so the short answer is the sooner the better, right? I'd rather somebody seek out support, and then we look at things and assess and say, I love the fact that you were proactive. You're going to be fine. There's a couple of things that we need to address. Let's just support you with that. So I'd rather it be sooner rather than later. The longer it takes, the more confused you're probably going to be, the longer it's probably going to take to get the results that you're looking for. So I think the shorter answer is the sooner the better. But with that being said, I always encourage women to listen to their intuition. Listen to your gut. If and some of us can't listen to it because it's clouded. There's so much information coming at us, and we're thinking about so many things. So take a walk on the beach, or take a walk, in the woods, and just be with your thoughts and just be with yourself and see what it says, right? Like, do you really need help? Do you think it would help you in some way? But I think our intuition is the most important. So if your intuition is telling you and your gut is telling you, yes, I need to get some help, I need a little bit more guidance, I'm confused, then don't ignore it, don't push it away, listen to it. The other part is, if you already know, we keep coming back to PCOS as an example, but I think it's a good example, is because often women will either find out or be put on the pill when they're teenagers because of PCOS. And so if you've had some sort of hormonal or reproductive issue when you were a teenager, start to get help as soon as you can, because that's only going to help you in the future. So if you already know, I was put on the pill because of X, Y, and Z, and it wasn't specifically because you were sexually active and you were trying to prevent a pregnancy, then I would say go get support sooner rather than later. And then, for me, it's also then finding the right support for yourself. And so most of us are going to start with our OBGYN. And so I would say, okay, that's fine, but they are not the end all be all, and they do not need to determine your path forward. Now, if you find an OBGYN that you trust, who is listening to you and open to supporting you, then all the power to you and them and that relationship. That's great. I will just say it's probably not going to end there, right? Like that might be where it starts, but I would encourage you, even if they say everything's fine, oh, we've done all the testing, I would encourage you to get a second opinion. And what I'd say there is to say, get a second opinion from someone who's not an OBGYN. And why do I say that, right? Because I like to use this example, this analogy. If we're standing on Earth looking at the moon, we could see the man on the moon. If we were on some other planet on the back side of the moon, there would be no man on the moon. Let's just say. Let's just say they can't see it at the same time that we can see it. Okay? And if you were to have a conversation with them, it's like, I see a face. I'm telling you, there's a face right here on the moon. I'm like, no, there's no face. I don't see a face. There's nothing there. It's all about perspective. Okay? And life is very much about perspective. And so you need a different perspective, I think, to check the boxes and be able to tell you that, yes, what they said was accurate, or I think things might be a little bit different, and here's why. And if that resonates with you, great. And if not, but if we keep getting the same feedback and same information from basically the same type of medicine, we're always going to hear roughly the same thing. So they're all trained in the same fashion. So then you can make a decision about how you want to proceed. What's the best path that you think is appropriate for you? But at least you've gotten at least a second or a third opinion, and they have differing perspectives, different modes of assessment and of looking at things. And most often your OBGYN is going to be limited in terms of both in what they're allowed to order and their knowledge of ordering. They're going to be limited on tests that they can order for you versus a functional medicine provider who has a much broader breadth of labs available and understanding on how to use them and order them. So
that's good on a lot of levels. I talk a lot about how my husband thinks I am crazy because I don't trust a doctor's word as gospel. I was like, they told me I couldn't have kids. They gave me birth control and nearly killed me. Like, what? I'm the crazy one here. But I love, because what you said about perspective, it's so true. I say this time and time again, a doctor is only as good as their experiences. If they haven't experienced your scenario, they're not going to know what to do for it. That's why you have, brain surgeons and whatnot, because they've been there, they've done that, they've tested, So I think that is just invaluable insight to say, seek out a second opinion, and because we don't know what our doctors have done, And another thing is your doctors work for you, whatever the field is, whether it's functional, whether it's, it's like a personal trainer,
100%, 100%.
So
yeah,
if you're on a journey, as my dad always says, figure out where you're going before you figure out who you're taking with you. Same kind of thing. If you're in a journey and it's a fertility journey, or you want to have a child or whatever it is, and your doctor's just sitting here, saying one thing, and that's not vibing with you, then maybe it's time to look elsewhere. So that's
I love
just
that.
Good stuff.
100%. I agree with all of that. And the addition to that is right now, the way Western medicine is set up is we're all specialists in our specific niche. So what that means is we have our blinders on and we can't look to our left and right. We can't look at the other systems. And so then they don't even think the other systems can really impact your hormones and fertility. And so now you're compartmentalized into your uterus and ovaries and nothing more.
Right.
And that's not how your body works. Your body doesn't work in that way. It doesn't have walls and barriers. It's all communicating constantly. So you need someone who's going to take a step back and have a broader perspective and understanding with the lens of fertility or reproductive health.
No, that is an excellent statement to make, because we forget how our body is connected. And I literally just wrote a blog about this not that long ago about, connected health. And I just focus on a couple different aspects of it. But, we try to isolate.
Yeah.
And then, but our body's not isolated, everything works in tandem.
Right.
So if something's off here, something's overcompensating there. Like I'm a big tennis player. So I also have like a first rib gone, do the whole blood clot thing.
Okay.
So my right side overcompensates for my left side every time I'm playing because I don't have certain things attached that other people do. Right. So even though it's my right arm, that's my left arm, that's the missing rib, it's my right arm that still needs work too, because this is overcompensating for that. Yeah. And we forget that, just because we have a problem, with our ovaries doesn't mean that there couldn't be something with our gut or, our vagus nerve or our mental health or, but we're breathing in our environment all the time. Like, when's the last time you had your air ducts cleaned? Like what foods are you putting in your bodies? What chemicals are you using in your house every day? It's like, it's not as much as we want to have experts and specialists in certain areas they are essential and we need them. Sometimes you need to like step back and look at the Monet as one whole picture to really get a sense of what's going on. Otherwise it's just chaos.
Absolutely.
Chaos in there.
Absolutely. I mean, you said it beautifully. I couldn't agree more. I think that's such a valuable piece of information for those listeners to take.
Oh, I'm just piggybacking off of you, so we're good. So what makes your approach different and, pretty successful? You've had a lot of success with helping people on their fertility journeys.
Yeah, I think it's exactly what we've been talking about. For me, it's about really my goal is to get to the root issue. And so often it has very little to do with hormones or the uterus or the ovaries. I put out videos on a regular basis on YouTube, and this week's video is actually a perfect example of that. The one that's coming out tomorrow is a woman who she'd been trying for 7 years and done repeated IVF cycles, went to visit all sorts of doctors for all sorts of issues, and everyone was like, I don't see anything. I don't find anything. You're fine. I don't know why it's not working. And all I did with her before she got pregnant was I put her on a detox. I'm not saying it's like it's a small thing, but we put her on a detox, and then I cleaned up her overgrowth of candida, and I supported her digestive system. Mm-hmm. And this doesn't happen all the time, but in 3 months or 3.5 months, she was pregnant. And I did not do one thing to, support egg quality or restore ovarian function or support her uterine environment. I even think I took her off of her prenatal, so it's just an example of what's possible when we actually address what's really there in front of us, which is why I was using that example earlier about the blinders, because those blinders make you not able to see the digestive system issues. And so she had issues, and she went to her, gastroenterologist, and her gastroenterologist didn't find anything, but he's not talking to the reproductive endocrinologist. And so, there's very little comprehensive look. So really my goal and my approach is to take a step back, not get hyper-focused on the fertility piece in and of itself, and really do an assessment for them as an individual. And then from there, create a plan. Now, sometimes it requires more testing, whether it's a stool test or more advanced hormone testing or whatever it might be. Environmental toxins, you mentioned something about the air before, so those things. So we want to look at what's getting in the way, and we make those decisions based on somebody's history first and foremost. And then if none of that has panned out and we don't find anything there, then we kind of start to broaden our search. But really for me, it's about getting to the root issue and treating each individual as a unique entity. So what they need is different than what somebody else needs. And we could take 10 PCOS women in a room, and they're all going to have or should have probably a slightly different, if not dramatically different, plan or approach based on their history, their hormones, their other systems, and how they present And so that's really what my goal is to create a unique plan for each person who is working with us to address them as an individual.
I love that you said that, because healthcare should be individualized, you know, and the fact that you can have all these generalities of what's normal. It's like, well, that's bogus information, that there's a normality in any aspect of life. Let's be real here. There's a common end.
Different than normal. Yeah.
Different than normal.
Yeah.
So, you know, it's like there's this whole bell curve we should all be on. You can't have kids after 40, but, you know, your best friend did, and you should be able to lose weight. And then you're just like, but everybody's different. So how can we have a healthcare system that is telling us that we need to be on this version of the bell curve when none of us are anywhere near that, because we're just individuals? So thanks. I like that you touched on that, because that's a really important part of health and wellness.
Yeah, absolutely it is. And that bell curve example you gave, I see it all the time in pregnancy.
I can imagine that. Right? You see all kinds of things.
They get this, they said my baby's too big, or my baby's too small. Yeah. Well, it's a bell curve for a reason. You know, everyone's not going to be at the top. You've got to fill the curve. It's not a big deal. And how tall or small are you? It's fine. Right.
Exactly. So. That's a really good point. I was a big baby, so well, pretty big. So I just thought about that, and compared to my son, sorry, train wreck.
It's like
okay. Squirrel, butterfly. How can empowering women to trust their bodies positively impact their fertility?
It's a beautiful question. Look, I think inherently, we need to trust ourselves in general, and believe in ourselves that we have the ability to do the things that we were created to do.
Amen.
Right? I mean, sometimes things get in the way. Sometimes it's us, sometimes it's other things. And if we can kind of filter through that and get past some of these things, then your body knows what it needs to do. It was created to do these things. It's not like it needs to be taught it. We just need to get out of the way and support it in the right fashion. And so that empowerment piece is really important, because I think it's taken away when we're told you can't, you won't, you need donor, or whatever it is that they tell you. Those thoughts go into our head, and it starts to chip away at our belief in ourselves and our abilities, and takes away our empowerment to do things and accomplish things. We can accomplish whatever we want in life if we believe in ourselves and put in, the time and work. I'm not saying that we all have to work hard at our fertility, but I'm talking broadly about anything you're trying to accomplish in life. And so, but sometimes we need guidance, and often we need guidance. I don't think we often look at it as guidance. Like sometimes our mentors and teachers are our best friends, or our parents, or our siblings. Sometimes we're actually purposely seeking out a coach to be our mentor, to guide us through things. And when I look back at the things that I've always accomplished, I've always had someone supporting me. There's always been someone I could lean on for something. If I had questions, whatever it might be. And I don't think fertility is any different. It's hard to treat ourselves and support ourselves. It's hard to see through the chaos. And so having a coach or a physician or a guide who's able to kind of help you filter through those things and guide you through that process is very empowering if you have the right person, because that person should be empowering you to make better decisions and to be able to, understand how to move forward. So just because you're seeking out help doesn't mean you can't still also be empowered moving through that process. I think so much of it is about empowerment and believing in ourselves and restoring that.
Well, yeah. And I think there's always a sense of shame sometimes if you are asking for help in any capacity, personally, I've struggled with that my whole life. I just thought if I was asking for help, it meant I was, incompetent or unable or, not good enough kind of thing.
Yeah.
That's a different topic for a different day. But so I think sometimes when we when our body might be struggling to do what it should be able to do naturally, admitting that can be like the first step, you know what I mean? Like just having that ability to be like, okay, this is not working the way I want it to. It doesn't mean there's anything wrong with me. I just need to figure out what to do to get where I want to go, and kind of like reframing it in our brain that it doesn't make us less than or incapable. We just might have to go about it a different way.
Yeah, absolutely. You know, I tell my kids all the time, like, you're not going to be great at everything. So, you know, it's okay. We have to find our strengths and understand, see our weaknesses. How do we overcome them? Like, what do we need? What sort of support do we need to move past that? That often means we need to ask for help.
Yeah, no, I think that's a beautiful statement. Just ask for help. What about words of wisdom for people who who come to you saying they've tried it all, they're struggling to get pregnant, or they've been told they can't? What guidance do you give them before going to IVF? Or do you just say, oh, you've done everything, maybe you should try IVF? How do you help them make that decision?
Yeah, well, for, you know, different situations and scenarios require, you know, I think different paths forward. So I'm not opposed to IVF. I just think that, you know, roughly 80% of the population moves there unnecessarily, and they haven't tried other things or given themselves a chance prior to. Now, we all have different paths in life, and we all have different markers or different things that are important to us. Like some of us want X amount of kids by X age or year, right? So that Definitely. Will sometimes propel us to make certain choices and move forward with IVF, you know, even if we've tried other things, because, hey, you know, I said I was going to have kids by the time I was 40. That means I need to be here, right? And so that guides people's decision. I really want to be a sounding board for couples and be able to give them perspective and understanding for things they don't have perspective and understanding for, so that they can make the best and most informed decision for themselves. I'm not here to tell you you should or you shouldn't do IVF, or you should or you shouldn't try naturally. I will give you my opinion based on history. I will also tell you what I think is realistic in whatever time frame. And then, you know, we all have to make those decisions. I think that time factor is a big elephant in the room that causes us to make certain decisions before we want to. And, you know, whether we don't want to have children over 40, or whether we don't want to have children over whatever age we say to ourselves, or whatever amount of kids we want to have, that's not my family planning, that's theirs. And so I just want to give them an understanding for what's possible, what's realistic, what makes sense. And if they want to go through IVF, that's fine. I just want it to be successful for them in as short of a period of time. And so that still might require us to do some investigation and understand what's going on. And it still might require you to give yourself some time to support yourself to get those results. So it's really a matter of trying to meet them where they're at and then giving them information. I have the fortunate experience to have gone through IVF cycles with so many couples, understanding their experiences, understanding what worked for them and someone who's just kind of starting to look at fertility treatment really doesn't know what they don't know. So I want to be able to give them that information and allow them to ponder what makes sense for them as a couple. But often my feedback to them is, I want you guys to draw a line in the sand, and I want you to create a timeline for where that line is going to be. You know, we're in August right now, closely approaching September. So around this time of year, what I say to couples is, look, we've got roughly 4 months until we hit the holidays and hit a new year. Okay. So what I want you to do is, or what I think would be a realistic timeline to give yourself and a place to draw the line in the sand, is to say, well, come January 1 or January 2, let's the two of us sit down, not me, I mean the two of them, sit down and have a conversation. Where are we now? What have we accomplished? And we said that when we got to this point in time that we were going to move forward with IVF, or we were going to move forward with whatever. Do we still want to do that? And if that still makes sense, great. Where do we go from here? Right? But for me, that line in the sand allows them not to ask those questions every week or every month or every cycle, because that becomes stressful for the relationship. There's lots of variables that are difficult with that conversation repeatedly over and over. And so I just think drawing that line in the sand, and it's like, hey, we're just going to give it these 4 months and do whatever it is that we're going to do during that time. But then when we get to that line in the sand, we can reevaluate. We're happy with the path we're on, or we're not. And now we move forward with a different path. And so at least you're not having to ask yourself that question, on a daily, weekly, or monthly basis.
Yeah, that would be exhausting, I think.
It is.
Honestly.
It is.
I haven't had to ask it, but I could imagine for other people it is just like debilitating to a certain degree. Where can people find you if they want to learn more about what services you offer?
The best resource I like to recommend is my YouTube channel, just for, free resources, free information. It's called Fertility TV. And usually I put out a new video every week, but sometimes I don't.
It's hard sometimes.
But so that's a great, just natural resource for people to refer back. Hundreds and hundreds of videos there. If not, you can just find me on Facebook, on Instagram, a little bit on TikTok, and on my website, marcsklar.com.
Do you offer virtual consultations for people outside of California?
Oh, yeah. So we have a coaching program that we work with couples in throughout the entire world. We have couples all over the world that
awesome.
that join that program and get our support and our coaching. We daily, weekly. Like before I got on with you, I was on our private group and I was answering questions for everybody. So yeah, it's on a regular basis.
That's awesome.
Yeah.
There's so many avenues to get in touch with you.
I do my best to respond to most of them, but sometimes it's hard.
It's hard, especially creating all that content. And I will say, I have checked out your YouTube and your Instagram, and there's great videos on there for all different kinds of things. So people should definitely look into that. Is there anything else we didn't know we needed to know about our fertility?
There's so
loaded question.
Really, I want all the listeners to take out from this is believe in yourself, and start to believe that you can do it, and start to restore that belief and empowerment in yourself to accomplish what you want to accomplish, because I think that's so important, and really get the proper guidance and support. You don't have someone who's listening to you, who hears you, who's there to be supportive and work with you as a team, then you need to find somebody else to work with.
Amen.
Yeah.
Right? You got to have somebody cheering you on.
Yeah.
Right?
Yeah.
Right?
Absolutely.
That's just life.
Yeah. If you're just a number in someone's clinic, it's not going to work.
I see. There's so many tangents I could take in this conversation, so I'm gonna spare you. Thank you so much, Dr. Marc Sklar, for hanging out with us and sharing your fertility expertise. I'm the mom who knows nada. My name is Brianna. Until next time, have fun learning all the things you didn't know you needed to know.